What is high blood pressure? What are the numbers? And what causes high blood pressure? I'm Dr. Jen Caudle. We're going to jump right in. High blood pressure is also known as hypertension. The two words are pretty much interchangeable. Now, your blood pressure is determined by two things: the amount of blood the heart pumps and how hard it is for the blood to move through the arteries. High blood pressure happens when the force of your blood pushing against the walls of your blood vessels is too high. Okay, now let's jump into what your blood pressure should be. Now I'm going to show a chart here. This chart represents guidelines established in 2017 by the American Heart Association, the American College of Cardiology, and 9 other health organizations. As you can see here, a normal blood pressure is considered a systolic blood pressure, that's the top number, of less than 120, and a diastolic blood pressure number, that's the lower number, less than 80. Now, moving on to the category of elevated blood pressure. An elevated blood pressure means that your systolic or top number is between 120 and 129, and your bottom number, the diastolic, is less than 80. Now, moving on to high blood pressure or hypertension stage 1, that's when your top number, the systolic blood pressure, is between 130 and 139, or your bottom number, diastolic, is between 80 to 89. And finally, stage 2 hypertension or high blood pressure is when the top number, systolic, is 140 or higher, or your bottom number, the diastolic, is 90 or higher. I do want you to know that there are other blood pressure guidelines, and based on your underlying conditions, medications you're taking, things that have happened in your life, your doctor may choose to follow other blood pressure guidelines for you. They may want you to have a different blood pressure goal based on these things. So please keep this in mind and remember that who should be determining your blood pressure really should be your doctor, because they know all the things that's been going on with you. Now, what causes high blood pressure? High blood pressure is generally caused by a combination of things, a combination of lifestyle choices. I'm going to go more into that. It's also a combination of genetics, which we tend to not have much control over, and then other health conditions, medications, and other factors, okay? Remember, some of the causes of high blood pressure we can control, some of them we cannot. Let's talk about now some risk factors. Now, these include some genetic and, say, non-controllable risk factors, and this list also covers some controllable risk factors, okay? In no particular order, age can be a risk factor for high blood pressure. We know that as we get older, advancing age is associated with increased blood pressure, okay? And it's also associated with an increased instance of high blood pressure. The next is obesity. Now, obesity and weight gain are major risk factors for high blood pressure. Family history. This is part of the genetic pool. We can't do much about our family history, but that's a risk factor. Also, race. Can't do anything about your race, but high blood pressure tends to be more common and more severe in Black patients, okay? A high sodium diet, which we do have control for the most part over our diet, but excess dietary salt intake can increase the risk of high blood pressure. That usually goes along with decreased potassium intake. By the way, I have videos on foods that are best and worst for high blood pressure. I want you to take a look at that. I will link some videos here. If you're watching on Facebook, let me know and I can send them to you. Also, excessive alcohol consumption. So drinking too much alcohol really is associated with the development of high blood pressure, okay? Physical inactivity. We can control, in many cases, how active we are. Physical inactivity, not being active, increases your risk of high blood pressure, okay? Not getting enough sleep increases that risk. Also, a history of gestational hypertension. If you had high blood pressure when you were pregnant, you may have a higher likelihood of having high blood pressure later on in life, okay? Now, there are other factors. That's not an all-inclusive list of the risk factors, okay? Now, there are sometimes other things that can cause high blood pressure. Sometimes certain medications that you need to be on can raise your blood pressure. Examples of these would be like steroids, corticosteroids, prednisone, etc. Non-steroidal anti-inflammatory drugs can raise blood pressure. Things like ibuprofen, etc. But not just that, sometimes underlying conditions that we have can cause our blood pressure to be high. Like kidney disease can lead to high blood pressure. Sleep apnea can increase your risk of having high blood pressure. So you see what I mean? The point here is that there are a number of things that can cause high blood pressure. Lifestyle choices that we make, genetics, which we can't do anything about, and then underlying medical conditions or medications that we have to take, which may or may not be in our control. The point here is there are often many things we can do to help lower our blood pressure, but not always, and not everyone is entirely in control of your blood pressure. So keep that in mind when you're thinking about this. I do, again, have a playlist on YouTube that has all my high blood pressure videos, foods that will help, foods that can hurt, ways to lower your blood pressure naturally, other things your doctor can do. I want you to take a look at that again on Facebook. Just message me if you don't see this. I'm Dr. Jen Caudle. Please share this video with other people. Follow me on Facebook. Please subscribe to my channel on YouTube. Please follow me on social media everywhere at Dr. Jen Caudle. Also sign up for my free health newsletter at drjencaudle.com.